Catherine? Kathy? Do you want to go next?
Yes, thank you. My name is Catherine Nolarius. I am an interested community member and I call myself an immigrant advocate or inclusion advocate. I currently work with not Forward Service, World Relief. Thank you.
And Mr. Harris?
Hi, I'm Mark Harris. I'm the county executive, and I'm just here as an observer today and to be helpful in any way I can.
Thank you. Sarah?
Sarah Mulbauer, and I'm a community member and just somebody who is passionate about diversity, equity, and inclusion.
Mike Norton?
I'm Mike Norton, a county board supervisor. I've been interested in these issues for a few years and trying to get such a commission started for the last couple of years. Thank you, Beth.
Welcome. Heidi?
Hi, Heidi Keating. I started at Winnebago County Public Health just March 1st and as the public health planner. And I've been asked to assist in strategic planning.
Welcome.
Thanks.
Mary?
Hi, I'm Mary Siebert. I'm the Director of Child Care Services at the Nina Menasha YMCA. And I'm also on our YMCA Diversity Inclusion group for our association.
And let's go with Susan next.
Hello, I'm Susan Garcia Franz. I work in the Winnebago County Health Department, and I work with a very diverse population in my workload because I'm Spanish speaking and I have a high caseload of Spanish speaking members throughout a 9-county area that I serve, including Winnebago County.
Nikki?
Hello, I'm Nikki Uharty. I also work in the health department at Winnebago County, the policy and equity coordinator. Been coming to these meetings for the past year or so, and I am presenting today on some data.
And Serena?
Hi, my name is Serena. I am a citizen of Winnebago County, just here to observe.
Welcome. Darinka?
Hello, my name is Darinka. I'm a citizen of Milwaukee, but I attend UW Oshkosh. One of the assignments for one of my, I'm sorry, I forgot to say my majors. I'm a social work and Spanish major here at UW Oshkosh. It's my 5th year and I will be graduating next year. I'm simply here just to sit in. One of the assignments that we have is to go to a city hall or county meeting. This was brought to my attention literally probably 30 minutes ago, and I found very great interest in it. So I was like, oh my gosh, I need to attend this meeting. So I'm really glad I'm sitting in this meeting because there's a lot of problems with diversity and whatnot. So I'm really hoping to gain a lot of information about Winnebago County and how they're approaching these type of situations.
Well, we're glad you're joining us. Welcome.
Thank you.
Olivia?
Hi, my name is Olivia Larson. I am a nursing student at UW Oshkosh. I'm a senior 1 in the program right now, and for our clinical this semester, it's involved around community health, and some of our clinical hours need to be with community engagement. And I saw this meeting on the Winnebago County, I think it was the health department page, or just the Winnebago County page. And yeah, it sounded interesting, so I wanted to attend it.
Excellent. Karena?
Hi, I'm Karena Jolin. I work in the Aging and Disability Resource Center as the new assistant. So,
Izzy?
Hi, I'm Izzy. I'm also a social work major at UWO on my junior year. I have the same assignment as during Go, where we need to observe a community meeting, and I chose this one because it's something that interests me in the social work field.
Excellent. Me?
Hi, this is Mi Yang, representing the Hmong Service Center here in Oshkosh. I've been attending these meetings just to kind of see how we can help the community. Thank you.
Very glad you were able to make this one.
Thank you.
Anne? Go back to that one. It looks like there's a couple other people where I don't have a name. If anyone else wants to introduce themselves.
Hi, Ken. I'm Steve Binder. I'm a County Board Supervisor, District 13, and I'm also on the UW Extension.
Can't believe I missed you. Okay, anyone else that wants to introduce? And we'll move on to Nikki's presentation about some data regarding our county.
So it looks like it says host disabled screen sharing.
Okay. Oh, what a day here. Yeah, like I said, my right arm is broke, my left hand is broke, and my screen just completely is almost completely black. But let me see if let me make sure I can. Here we go. If you can be patient for just a minute.
I don't know if you found it yet. I think I may have enabled it for you.
Okay, thank you.
Try again, Nikki.
Glad you stayed on.
And Nick.
Yes, excellent.
And Nikki, you're muted.
Goodness. So you can see the screen now?
Yes.
Okay, awesome. So Mandy just asked me to share some demographics data today. I have a whole report on health equity data specifically that I've shared with County Board before. So I do have some of that information in here, so I apologize, it'll be a little repetitive for some of you who've seen this before. And then I did pull just some basic demographics from the most recent American Community Survey, which comes out of census data. So as I said, my name is Nikki Uharty. I work in the health department, and I'm the policy and equity coordinator. I've been here just over 2 years now. March marked 2 years. So just a little overview. Like I said, I'm just going to talk about some basic demographics data, then go a little bit over a health equity overview and share some of that Winnebago County health equity data, just because health is really my wheelhouse of the diversity and demographics discussion. So here are just some basic demographics. The total population, according to the most recent 5-year American Community Survey estimate, which was 2019, is about 170,000 for the county. We are the 7th largest county in the state. Sex-wise, it's about even. There's 50.4% males with 49.6% females, and the median household income for the county is about $58,000. This next slide here shows the age breakdown for the county. So you can see here in the 25 to 54 range is where we have the most for the population. I'll make this presentation available afterwards just because I know it's a lot to take in, but I don't want to read off every number to you. So I'll share it afterwards.
Thank you.
This shows educational attainment in the county. So you can see the largest percentage here is in the high school graduate category, and then the next two are bachelor's degree and some college at about 20% each. This is for folks age 25 and older, I believe. This is household income data. The largest portion here is in the 50,000 to about 75,000 range. You can see the other ones here. And that 50, I had shared at the beginning, the median income is about $58,000 for Winnebago County, and it's about $61,000 for the state. This is race and ethnicity. So you can see down on the bottom, white non-Hispanic, that is the largest portion here in the county with about 89%. And then the next largest category is Hispanic Latinx population at about 4.1%. And all of the non-white Hispanic people of color, that makes up about 11% of our population, which is about 20,000 people. This is the exact same data I just shared, just in a different format in a pie chart, just because I wanted to compare it to some other data. So this is total population, adults in Winnebago County, race and ethnicity. And then if you look at this next graph, this is race and ethnicity among elementary students in Winnebago County. So you can see a pretty big difference here. As I said before, there's about 11% people of color among our total population, where when you look at the elementary students here on the right-hand side, it's about double that, so about 22% students of color among elementary students. So that's really showing some shifting demographics and showing that our younger generations are more racially and ethnically diverse. So we want to create a community that's inclusive, where race and ethnicity aren't hindering people's opportunities and potential. This is languages spoken at home according to the American Community Survey. About 94% speak English only, and then they just bulk it all together, languages other than English that they didn't put specifically into these other languages here, like Spanish, other Indo-European and Asian and Pacific Islander languages. So Spanish is the next largest language spoken at home, about 3%, and they categorize this, that I can't remember the exact way it's categorized, but like do not speak English very well. So primary language at home would be something other than English. And then this is from our 2019 community health assessment out of the health department. These show the number of different languages reported at home at the school districts in the county. So Menasha and Neenah are grouped together. They are two different school districts. But those are together. But you can see in the Oshkosh Area School District, for example, there's 59 different languages reported that are spoken at home. So that was kind of mind-blowing to me. That's a lot of different languages. And then just some miscellaneous stuff that I found interesting. Among our total population, there's about 12% of people who have a disability. And then if you look at it by age, our 65 and older population, that number goes up to about 30.1%, so much bigger proportion. And then technology, I think I found this interesting because if you've tried at all to make COVID-19 vaccine appointments, you know that most of them are online. And at the health department, we've tried to save some of those spots every time for people to call if they have technology barriers. So in the community survey, they had the total households with a computer is about 90%, and then those with a broadband internet subscription is about 84%. So that was just interesting to me. And then among households, the married couple family is about 46%. So it's just all some basic stuff. Now I'm just gonna go into our health equity data specifically, just because that, like I shared, that's really where my expertise falls and what I've worked on with the county. So just to go a little bit over what impacts health. When people think of health, they often think of individual behaviors like smoking or exercise or going to the doctor. But this model here shows that there's actually a wide range of factors that influence how long and well we'll live. About 50% of our health outcomes are actually determined in large part by our social, economic, and environmental factors like housing, transportation, education, income, a lot of those demographic factors I just shared. Just to make sure that we're all on the same page, I wanted to share some definitions too that we go over. So health disparity is a difference in health status and mortality rates across population groups. And then an example there to put that into perspective is breast cancer rates are higher among women than men. Just a difference, not necessarily unfair, unjust difference. And then when we talk about health inequity, we go a little further. That's a difference in health status and mortality rates across population groups that are systemic, avoidable, unfair, and unjust. And the example here is Black women and white women experience similar rates of breast cancer, but Black women die at a higher rate of breast cancer than white women due to inequitable access to care. Health equity, the definition that we use at the health department is the same definition from the Robert Wood Johnson Foundation, which is health equity means that everyone has a fair and just opportunity to be as healthy as possible. To achieve that, we must remove obstacles to health like poverty, discrimination, and power imbalances, and the consequences from those like powerlessness, lack of access to good jobs with fair pay, quality education, good, safe housing, safe environments, quality healthcare, all of those different things. And then I like to share this image too, just because sometimes people can confuse equality and equity. So equality is really about sameness, where equity is about fairness. This top image here shows that everybody has a bike. Everyone has the same bike, but it's not necessarily working well for everyone. Or if you look at the bottom half of the image, everyone has a bike that really fits their need and works for them. So equality is ensuring that everybody gets the same thing, where equity is ensuring that everybody gets the something that they need. Inequality only works if everyone starts from the same place. We can see in that top image, not everyone's starting at the same place, so that same bike doesn't work well for everyone. And equity is really a customizable approach. And it can be a waste of resources too if we're not giving people what they really need. So another good example I like to help put into perspective is if I gave everybody on this Zoom call a size 10 pair of men's shoes, would that work for? Maybe a couple of us. I know it wouldn't work for me. So I could give it to everybody and everyone would have the same thing. That's everyone has something, that's equality, but you're not all getting the thing that you really need, so you can't even use that. So like I said, just gonna share a little bit of data, but across the United States, Wisconsin, and even within our own county, there are significant differences in health outcomes from one zip code to the next and among racial, ethnic, socioeconomic groups. These health inequities emerge when some individuals and groups are gaining more from others, or gaining more than others from consistently having better access to opportunities, resources over the course of their lives, and sometimes the lives of generations before them as well. So data shows that there's fewer opportunities and resources for health among groups that have been historically marginalized, like people living in poverty, people of color, people with physical and mental disabilities, people who identify as LGBTQ, and I'm sure there's more. And these differences don't arise on their own. They're often the result of policies and practices that have created barriers to good health, often unintentionally. And there's lots of great examples of that. I didn't have long enough to include all of my policy examples in here too, but if you do have questions about that, feel free to reach out to me and I can share some examples of that. So in the health department, we have an internal health equity team, and we created this little mini data report to share some data on determinants of health and also some health outcomes data. We had done an assessment among our staff regarding health equity, and one of the things that folks wanted to learn more about is specifically what health inequities existed within our county. So we often hear about the ones that can be more at a state level or nationally, but wanting to know really what are the local inequities that exist here in Winnebago County. So the report has more information than I'll share in this presentation, and there's a lot of in-depth explanations of that data within the report too. And you can see that the link is here in the report. And then the next data that I'm going to share for the rest of the presentation is all specific for Winnebago County unless otherwise noted. So this first one here shows that how much money you make impacts how long you live. This is showing male life expectancy in Winnebago County. It shows that the males with the lowest income are dying on average 11 years younger than males with the highest income level. There's a large body of evidence and research out there that tells us that income is a determinant of health. Obviously, a higher income increases our ability to have those essential elements for a healthy life, like healthy food, safe living conditions, quality health care, good education, things like that. This here, I know it looks like a lot. This is the households facing financial hardship by municipality. The data comes from United Way's ALICE report. So ALICE stands for Asset Limited, Income Constrained, and Employed. So that means households that earn more than the federal poverty level, but less than the basic cost of living for the county. So the ALICE threshold is the average income a household needs to afford the basic necessities, and that is specific for each county. So Winnebago County's ALICE threshold is going to be different than Ashland County or Juneau County. So in Winnebago County overall, 23% of households are ALICE households, and 11% of them are households in poverty. So combined, that's about 1 in 3 households in Winnebago County who are struggling to afford basic needs. And then this chart here shows the difference in ALICE and poverty households by municipality. So you can see that Algoma has the smallest amount of households there, and the portion of the city of Appleton lying within the county is the highest. So you can see that this differs based on zip code, geographic location. According to the 2019 Youth Risk Behavior Survey in Winnebago County, 40% of students who identified as lesbian, gay, bisexual, and or transgender reported seriously considering attempting suicide in the last 12 months, compared to 12% of students who identify as straight and cisgendered. Cisgendered means someone whose gender identity aligns with their sex assigned at birth. So an example is my sex assigned at birth is female, I align with that, my gender identity is woman. This one here shows children in poverty by race and ethnicity in Winnebago County. So it shows some significant differences in the percentage of children living in poverty by their racial or ethnic group. That can be linked to differential access and opportunities and resources. Children living in poverty may experience lasting effects on academic achievement, health, and income into adulthood. Children in poverty have an increased risk of injuries from accidents and physical abuse and are susceptible to more frequent and severe health issues throughout their life, like asthma, obesity, anxiety, behavior disorders, ADHD, cavities. You can see here that significant differences, but really big gap here among our Black children. And then the last, I think the last piece of data I have for you is percent of low birth weight babies by mother's race and ethnicity in the county. So you can see some differences here as well. Some low birth weight babies grow up to be healthy children and adults, while others can face serious health problems over their life course. The highest percentage of low birth weight babies in Winnebago County, as you can see here, are born to Black mothers. That racial disparity is attributed to social determinants like income, racism, toxic stress, and lack of access to healthcare resources and opportunities. So a really interesting piece of data, something that really stood out to me, I know when I was in college, is that research shows that even among Black women with an advanced professional degree, infant mortality rates are still higher than among white women without a high school education. So oftentimes education and wealth can help explain those differences in health outcomes. But here it's saying that that's not the case. And there's a lot of research done, I believe out of Harvard, and the researchers have linked it to chronic stress caused by discrimination and racism. And then, like I said, I have a ton of information on policies and practices that have led to a lot of these outcomes, but didn't have time for that today. So if you're interested, let me know.
Sorry about that. Are some of those policies and things on your website?
I'm not sure if they are in that report or not. I would have to check. I can't remember. It's been a year since we published that. But I mean, the biggest one that like I can think of like just off the top of my head right now is redlining. You know, lots and lots of years of that have led to some of the significant racial disparities we see. Another one that maybe would resonate a little bit more with people is paid family leave policies. So those are often different among blue collar and white collar workers. And another good example within that is even your like regular level staff versus management. I know I have a friend who works for a healthcare system, and she was pregnant with her second baby and was in a management position and really wasn't enjoying it. But she got an extra 4 weeks of paid maternity leave as a manager. So she stuck it out just because of that. So you can, you know, then staying home with your kids too during those really important first 3 months can have a big impact too. So,
yeah. Anyone have questions for Nikki?
Nikki, considered low birth weight is it 6 pounds or 7?
I think it's definitely lower than 7. I would have to look to be sure, but it's a very precise number.
Yeah, I was curious. And really, really good information. I'm glad you'll be passing that along because very, very good information. Thank you for your hard work.
It's 5 pounds, 8 ounces.
Wow, okay, all right. Thank you.
I guess I just got a question. What is the health department doing to try to build equity amongst all the different races? You know, what are we doing as a county to help them to?
Yeah, so we have that internal health equity team, like I shared. A lot of it needs to start within the organization, build up some of our practices and policies to ensure that we are equipped to work with the diversity that's in our county. So like we do a lot of trainings, that sort of stuff. A really great example right now, our community health and prevention team has been working really hard with community groups, doing some outreach among some of our populations who wouldn't necessarily, know to go to our website or maybe have historically not trusted county government or government at all, and done some really specific reach out and targeting to get them vaccine appointments. So that's been a big one. We have, like, for example, at the last, I think 4 vaccine clinics, we've had staff. Susan, like she said, she's been coming out, Susan on this call, she speaks Spanish and has been out of those clinics. Susan, you can speak a little more to that if you want to share that example. Susan specifically working with that.
I think there's a number of things we do as a health department too. I mean, there's access to healthcare is a big tenet of a lot of the work that we do. So we work with, one is I speak Spanish, so we're working on that access piece with the vaccine right now. But overall, we connect people. We work a lot with our community partners between Partnership Community Health Center, St. Francis Clinic, St. Anne's Clinic, to make sure that access to healthcare is an issue, is not a barrier for people in our community accessing healthcare. Also, signing up for Badger Care, working on policy around that. I don't know if you recently heard, but there was a passage along the state line that those that are incarcerated now can continue on Badger Care. And that's a huge piece, because once they're released, then they need to continue health services. And sometimes having that access, having it cut off and trying to restart that coverage is sometimes a barrier to services, healthcare services. So I think there's a lot of things that we do that are on the ground that we don't always like put it out in terms of brag about all the things, but we really are working on housing, transportation, all those social determinants of health that determine people in our community really living their best lives. And so we work a lot on that access piece. How can we remove barriers? And so it's a big tenet of a lot of the work that we're doing at the health department. And we probably could do a better job of tooting our own horn about it, but really the work is in collaboration with so many others in our community. that, you know, that's that kind of behind the scenes work that when we do it well, when we can continue to do it, people get connected, and that's what you see in the community.
What do you feel this committee could do to help make your job easier?
I just honestly want to say that more resources to breaking down barriers could be helpful. So when we have issues of, so just as an example for transportation, you know, the Expo Center is a couple blocks off of the bus route. And so I know you don't control that because it's more of a city, that's more of a GO Transit. But the reality is if our services are outside of a service area that's serving the public, we should be addressing that. That issue should be being addressed. And we're getting a voice in that process right now. So in the meantime, if we can't change that system, can we offer more as a county? Can we take some of our resources and kind of switch them around to be able to take away that barrier for people getting? So my question is, how do people get to Parkview? How to work? Is the bus stop at Parkview for workers? You know, my question is, there's a lot of access pieces for a lot of individuals. So those kinds of things, it's the attention to detail of where there are access issues or barriers that if you can help us, you know, get more resources in those areas, that would be very helpful.
Thank you.
So what I'm hearing from that, Susan, and the answer to Steve's question is that I think we should find ways to take what we need to take our services to them. I mean, this pandemic and the vaccine, remember, is an example. It's the most topical example, but I think we need to reach out and find out how do we reach the populations of minority or diversity populations in this county, you know, Hispanic, Hmong, I want to say the Muslim, I always mix them mixed up, those type of groups to make them feel comfortable. They may not feel comfortable coming to the health department. They may not feel comfortable coming or how to get to the Expo Center, but I think what I'm hearing from this, Susan, I agree, we have to find ways to take how to better them, their health and whatever, to them more, maybe more directly, a little more effort than the average population, because they are not comfortable or they don't know what's available. So maybe that's what we can do in the future.
Mike,
I think, go ahead.
Sorry, I was just going to say a lot of what I'm hearing from the participants that we're working with is they aren't remembering or have never learned the science behind what a vaccination does. So I think that education piece from a very elementary point of view is huge. I mean, I've heard probably 3 times already today is, if I can still get COVID, why would I get the vaccination? So really putting that together with the elementary level is why this is important, how it works, and what your options are if you choose to get it, and what might happen if you choose not to get it, as far as how our cities and communities and organizations are working with whether they're requiring that for entry and that type of thing.
And I was just going to piggyback on that. In the current state budget, there's a piece on Medicaid reimbursing community health workers. If that stays in the budget, that's a huge piece. When you can hire community health workers and get reimbursement from Medicaid for those services, for offering those services, those are boots on the ground in the communities where people live, getting this education, being able to be out in the community with that kind of offering that kind of health benefit is huge. And that fight has been on the table for years, and it's finally moved. It's in the budget, so that's huge. So if it's a piece that can stay in the budget, it's going to help a lot of people connect a lot of communities to the help boots on the ground that they need.
Steve, back to your question about the role of this committee in helping some of that. I think part of why we're looking at the type of data that was shared today is to identify what areas need help. So, before we can talk about how either this committee or the rest of our community can help bridge some of the disparities, we need to look at what those disparities are, and looking at that kind of identification. This was one of the first steps in doing that, so that's a good thing. Anything else regarding this? For those of you, I know some of you have been part of just discussing these types of things for a couple of years now, probably. And for those of you who have not been part of that, we had a discussion that we opened up to any county employees. It was over lunch, where we had Erica present on some of her Hispanic culture and things that were important to her, and some of her experiences working in this community. And Joseph from World Relief, the same thing with some of his the importance of his culture and what it's like to live and work here, and opened up a huge dialogue beyond that. And one of the things in amongst the 4 pages of chat comments that I had was that people want more opportunities like that. They want, not just within county employment and this committee, but beyond that, people want opportunities just to learn more and have conversations about it. So I don't know if everyone had an opportunity to watch the interview about Waking Up White. If you want to maybe raise your hand in the chat or wave your hand to let me know if you did get a chance to see the interview. Okay, a couple of you. What it is Debbie Irvine is a person who wrote a book called Waking Up White. And it's interesting, she does a lot of speaking about it, but it's interesting because she grew up thinking everything was equal and really believed, as much as kids believe in Santa Claus, that everything is equal. And the guy interviewing her, who's African-American, kind of chuckles at that because, of course, his experiences weren't of that, but she talks about what made her realize that things are not equal. An example would be her father was in the World War II and benefited from the GI Bill. And so he purchased a very nice home in a very nice area at a very low cost. He was able to attend Harvard Law School free of charge. However, at that time, people who were Black and Brown Americans were not able to access the same thing. So they were comrades while in the war and in the service, but when they got out, there were a lot of lending associations who wouldn't lend to them, even though they were entitled to these benefits. The actual lending associations wouldn't lend to them. There were realtors who wouldn't allow a certain number of, they would only allow a certain number of households within a neighborhood to be non-Caucasian. So there was people identifying themselves as white so that they could get into these neighborhoods, but a lot of people, that wasn't going to fly. So we started creating disparities. You know, a well-intended GI Bill, when carried out, created some long-lasting disparities. And so that was one of her examples that was kind of, I don't remember the term she used, but kind of earth-shattering to her to say it's not equal. They both served the same and they were both entitled to the same benefits, but they weren't able to reap the same benefits. And we heard that early on in some of our discussions about people in Winnebago County who are of Hispanic descent who are US citizens, but they're not tapping into Medicare because there's some thought that by accessing Medicare as they're entitled to, that they will potentially be deported. And not only were they choosing to not take advantage of that benefit, but they didn't realize that they're penalized because if you don't enroll in Medicare when you're eligible, there's a penalty for that. So it was sort of a double whammy. And so it's those kind of things that the author was bringing to light. Enough of me talking. If people who did get a chance to see the interview or read the book want to share some of your insight or questions that you had or certain comments, that would be great.
Beth, I just want to mention, you know, that area was highlighted on the agenda, but I went in about 2 into the agenda and tried to click on that item and it didn't link you to the video.
I know I had to, yeah, I had to like click on it a certain way, but I I can send out, actually, it might be easier if I just give you the information. It's on YouTube. And if you go onto YouTube and look at Waking Up White interview, it is a 39-minute, oops, just a minute. Let me get you the right site. Because I had problems with our county computer when I was trying to access it. And so I'm looking at my phone right now. I had to go onto my phone to be able to do it. And what I did is I went to YouTube, and then once on YouTube, I looked up Waking Up White interview. And then when you're in that, it's a 51-minute and 11-second interview. And it was streamed 4 years ago. I'm looking at the person who's interviewing her. Is on the Felipe Matthews show.
Beth, I just put
BHILL.
I put a link in the chat too.
Oh, thank you.
You're welcome.
So maybe people can cut and paste that. And I'm sorry that not all of you got to see it, but part of the point in that not all is not lost, because part of the point in wanting people to take a look at it is wondering whether this interview would be something worthy of doing a sort of a community Zoom. So anybody from the community could log in, view the interview together. They wouldn't have to go on ahead of time. They would be able to, we would all watch it together. And that's like I said, about 50 minutes, and then having a 40-minute dialogue after that. So it'd be an hour-and-a-half Zoom session for those who would be interested. And I think that's part of the input I'm looking for is, was this segment something that you felt, for those of you who were able to view it, that you feel would be worthwhile?
I guess what I can say, Beth, is, when Mike first asked me to attend these diversity meetings, I didn't really think there was a diversity problem, and when I watched the video, I can see that where I live, there isn't one. We all have nice cars, nice houses, until I go into the inner city, like the blighted area of Oshkosh, and then you can really see how people of need are living, and how do we raise their standard? Because we need to. They don't have to live with, plastic over their windows and their railings falling down. And, it's sad to think that in a country as great as what we're living in, we're letting people live like that. So yeah, I think people need to wake up. It's here. Yeah. We just got to basically, it's not where I am. No, I never seen it until I went and looked for it.
And she brought up some great examples. One of them at a point in time when Native Americans were put in certain programs where they had their tongues cut if they were speaking English, or weren't speaking English. If they were speaking their Native American language, they had their tongues cut. People who experienced bleaching to try and change the color of people's skin. So that may not have happened last year or even 10 years ago, but there are certain cultures who hold the fear of the government, because those were government programs, not in our state, but they hold that fear of the government. So I work for Winnebago County, and some of the types of people that you're talking about, Steve, would be very, very unlikely to come to our building for help. They would be maybe not likely to access something that they view as government because of fear of the government. And I know that one of the things we want to do post-COVID is to have, Joseph offered to do this for some of the refugees, and we had a couple other people offer to bring some people in to say, this is who we are, this is what we do, what can we do to make this more welcoming, and get word of mouth out to different people to say, we are truly here to help you. There's that stigma that we've also talked about, that the Human Services Building, we put people in nursing homes, take away kids, and we're the welfare agency. And that's, most people know that's not true, but there is a stigma. So how can we overcome the stigma of people accessing assistance with getting windows put on and financial assistance and job help, because the percentage of people accessing programs is grossly, underrepresented.
And you know, a big part of that I don't feel is actually that they're afraid of that help. Although I have a funny quick story about that. I used to translate for Salvation Army for their Christmas giving program. And I had somebody tell me once that their friends wouldn't come because it was called Salvation Army, which was government connected, and they did not want to be working with the government. So they were scared. So something as simple as that. But I think that what I hear a lot in the communities I'm working in is not necessarily that they don't know the programs are there. They're not very accessible. Calling and having to push numbers, and like, it's tough. It's tough to get through that system. It's tough to understand the terminology, even when you're born in the US. What's happening, and I know this is not all diversities, but because I specialize in diversities of people with immigrant background, the language barrier is huge. There is not a walk-in, get an appointment, sit down and talk to someone. There is not an application that has a lot of pictures versus a ton of legal jargon that even for someone born in the US is not easy to understand. The way the questions are asked are tough. And then every 6 months you have to redo that and screwing something up. And I mean, there's just so much to it, and it's not culturally friendly.
Have you had an opportunity to look at the Winnebago County website since it was made to be translatable? Because I think one of the big pushes to have that done was that there are a lot of resources on the website as well as employment opportunities. So now when you go to the homepage for Winnebago County, you can click on the top, and I had several people from various languages, from Spanish to Turkish to Latvian, take a look at it, and they said it seemed pretty accurate. But do you think that that's a step toward trying to help people gain access to things?
So I have a little bit of a skewed version, skewed opinion on that. Is I think it's great to translate into someone's native language, but that is assuming that they have skills to read and write in their native language. If we have pictorial, so I work very, very part-time for the airport, and any airline that I go on, doesn't matter what country, I can understand the safety procedures because it's pictures. And I think we would be doing everyone a favor if we were trying to do it more pictorial versus written words, I guess. No, to answer your question, Beth, no, I have not been back on there.
Okay, but it'd be helpful to get input on it, but your point is well taken about the pictures, especially when it comes to refugees. Many of the people coming to this country have very little education, so in addition to not speaking English fluently, they they're not educated within their own language, so that's a very good point. Other comments, questions about the Waking Up White interview?
So Beth, are you proposing that the community or someone watch that video and then leave their comments somehow? I mean, it's interesting. But before that, I don't know how you pull it off, but that would be an interesting thing to do.
Yeah, I guess I was thinking back to the conversation that we had with Erica and Joseph, where there was a presentation and then a conversation, and the number of people that were participating in that said we want to do more of this kind of stuff, and that was what, a year ago, I think. Maybe not quite, but this is one potential opportunity for another learning opportunity for people to again view it and then have a conversation. I don't know that this is the right presentation for people to hear. I liked it because of the woman's background and all that she came to learn and grow, and how candid she is about that. And the person interviewing her, I feel, does a nice job of pointing some things out. Some of the other points I thought that were interesting was they talked a little bit about institutional racism, and that's kind of floats through a lot of our discussions that we have here. And the other thing that, and I really, really appreciate, Catherine, your input about the pictures, because the other part of the interview is talking about how white people have a tendency to want to fix people. And she used a great example of something that she put into place. Very, very well intended, trying to help out some younger Black kids in the area that she lived in, and they weren't participating in it. And there's all this money to help them, and she couldn't figure out at that point in her life why there was money available and no one was taking advantage of it. And she does a really nice job of talking about how us Caucasians think that there's a need to fix people. And we've already talked about how there's a need to fix some of the problems that occur in our community. There's no question about that, but we shouldn't be trying to fix people. And so I think she brings up some really interesting perspectives on our history. I don't know, Mike, do you think it would be something that we could put out there for anybody to watch and then have a conversation?
Like I say, I'm for it. I don't know how you do that. I think two things. I think that's one part of it. A white Anglo-Saxon person, like that she had experience in and what her thoughts. And I think, and I still think that the presentations that we had in that diversity dialogue is very good too, because you also get the perspective of the person who, from a diversified background, what they feel being in an area where it's not very diversified, and we want to be more diversified in this population than people in Oshkosh or in Winnebago County. So if we can find, because those two things together would be something that would be great to present. And I don't know how you do that, but yeah, I think you have to give two experience. Thank you.
I think you're right that it's about this national book, but it's also about what's happening here in our community. I know we've been trying to strong arm me into either doing that for us or finding someone else in the Hmong community to do another one of those conversations where we can learn more. I know that the one that was done by the Muslims, was it last month, I believe, was not very well attended in our community. It was a very, very small number of people, including Mike and I, who listened in on that. I can't believe how informative it was. I thought I knew certain things about the Muslim history and current culture, and I was blown away by things that they shared. So we know we want to do more of the local stuff too, in addition to something like this.
Yeah, I'm going to echo what Mike was saying. And Mike, I applaud you for your bravery, but I kind of feel like we're all out here trying to promote inclusion, right? And here we have a white woman who's doing the speaking. Like, why aren't we having someone from a diverse background who's the one who's doing the speaking? And that said, if we did choose to go with her, she does have some TED Talks, which might be a little bit more short and to the point, instead of a time investment of we're watching a 50-minute video and then want to have a lively discussion. Let's do a 10-minute quick to the point TED Talk and then ensue a discussion. But there's a lot of TED Talks out there from people of diverse background that would be great to have as discussion pieces as well.
Yeah, I do think it's a dual thing in terms of many of us wanting to hear directly from people, whether it's our LGBTQ community or people from different races. I also think there's people who, as Steve mentioned, who are a little bit, I guess, sort of oblivious to what's happening in the community that might be more inclined to hear a white Anglo-Saxon woman share her perspective and her coming to light about all this too. So I believe it's
actually
both.
To add on to what Beth said, it's I've heard plenty of times, like as a white person, it's if you have a white person talking to you about your experience, and like Beth, if you shared with another white woman, it would mean more coming from you than a person of color trying to share that with you. And it often actually, this is a big word, but I can't think of anything less right now, not necessarily traumatizes, but it has an impact on that person of color trying to explain their experience to a white person when it really doesn't have that huge of an impact anyways. Like, it just like if there was another white male telling Mike Norton their experience, you're more likely to listen to that person because you can relate with their experience.
I've heard that numerous times. I've also heard several people of color from our community say, you know, we're not the ones that have to teach you. You guys got to figure this out. We shouldn't have to teach you how to deal with this. So again, I do believe it's both efforts, and even just the people of color. When I've talked to people in our community about people of color, what I hear is, you're just making it us or them. You're either a person of color or you're not. You're further separating it by saying that term. Another person said, when we say people of color, that we are grouping all people of different ethnicities together, and again, sort of disregarding some rich cultural heritage. And so, you know, I don't even know if we're using the right language sometimes, but it's learning from people that are experiencing it. And it's also, and I appreciate you kind of sharing what you just said, hearing from people of the same color and the same culture about what they've experienced and how they learned what unconscious bias and white privilege really are.
Beth, oh, I see she just unmuted. I was going to point out Darinka had her hand raised. I wanted to make sure she got it.
Yep.
Yeah, I wanted to point out that Nikki's point on how people will not listen to people of color when it comes to topics, these sensitive topics, but they will listen to white people. It's very much true. I lived it myself. I'm a person of color. I'm Hispanic. English is my second language. I had to take ESL growing up all the way to 8th grade. So, you know, I've in moving to Oshkosh has presented a lot of, it's given me a culture shock because I've never seen so many white people around me. And I don't know if I'm using the correct language, but it's simple as that. And, you know, I come from a city where, yes, it may be segregated, it may be very segregated, but I come from a city where I'm consistently surrounded by people of color, and we're all aware of this. And, you know, coming up here, trying to educate others on how, you know, people of color view society, on how they treat us, they were not willing to listen until I realized. I was like, so, you know, until I realized, and I attended, you know, another meeting or another event where it was about diversity and whatnot, and, you know, it was someone white who was speaking, and I was like, interesting. You know, the crowd was very diverse, but there is a good amount of white people in there, and I was like, and this is very interesting, because I feel like if it was a person of color speaking, that would only draw in people of color or people from minority backgrounds. So I just wanted to throw that out there, that I find that so interesting. And I had mentioned it in a class, like the beginning of the semester, and the professor said, well, why don't you talk more and about this situation? And I'm like, well, it's the simple fact that people will not listen to me, but they'll listen to you. They won't listen to me though, you know? So yeah, I just find it very interesting.
Thank you very much for sharing that, because it is a very odd and interesting thing that some people really want to hear from people who are experiencing being treated differently, and other people listen better to someone of their own skin color. I did a presentation at the Rotary this Monday, and the chair of that Rotary is the former owner of Tortilla Flats. So she's of Hispanic nature, and when I got done and there was some comments and questions, she shared that when she first moved to Oshkosh, she doesn't even remember how many times she went home crying about her experiences. And some of the Rotary members who have worked with her for years and been on the Rotary with her for years were just shocked at her comment. They had no idea that she had been through that. And actually apologized for the way our community treated her. But it was me bringing forth this topic to the group that engaged in the dialogue where then they did listen to her. It was a very odd thing. The other thing is some of you know that I'm appointed to the city's Diversity, Equity, and Inclusion Committee, and I'm the only white person on that committee, which I found incredibly odd. But then I realized that it takes all of us to figure this out. So what I can do is maybe the better route would be to let you have an opportunity to either watch that interview or see if there's something else that any of you have that might be a good presentation for the community that would invoke a conversation, or do enough of you feel like we should move forward with scheduling something? What's the consensus?
Go forward.
Yeah, I'd like to get the community involved, and I think sometime along the way, we got to reach the younger generation and let them know that if they don't get education, nothing's going to change. You don't get out of poverty unless you're educated. You got to, at the bare minimum, get a high school education so you can get a fair paying job so that you can move forward, and you look at statistics. I mean, 90% of lower income don't even have computers, and only 83% of them have internet. Well, we just had a year where that's how they had to learn. So I think we're really a lot of them are going to fall through the cracks. And if we're not there to help them, how do they catch up? So it's all about educating so that they can move themselves forward. Because if you get a good education, you can get a job at Oshkosh Truck. You can drive a semi. You can get a job at AMCO or Bemis. But if you don't have a high school education, no one's even going to hire you. So somehow we got to reach the youth and turn them so that they understand if they want more out of life, education is the first thing they got to accomplish. That's just one of my goals I would like to see us do.
It's definitely something that the school districts are also taking on, in addition to whatever role we might have. The man who is the Diversity, Equity, and Inclusion Coordinator for the Menasha School District was not able to attend this meeting, but he plans to join our group too, because and we've had people from the Senior Center and Housing Authority, because it starts young, but it's all of us that are impacted. And Nikki's numbers that shows that the youth in our community are a more diverse population than our adults tells us that we are becoming more diverse, and we're maybe not quite ready for how to help, as you just said, Steve, to put things in motion and help create equity so that those diverse students are an active part of our workforce and our leadership and our community contributions moving forward. So I will talk to Mandy about this video then. Any other comments before we move on to the bylaws?
Beth, it looks like Mary and Mark have both been trying to, and now I just interrupted them again, but if
Sorry,
you can.
I think, Mark, do you want to go next?
I just want to say that I think sometimes a group viewing or a group read can make a difference, because years ago, Appleton had a group read of the book Nickel and Dimed, which wasn't about race, but was about low wages. I didn't participate in that, but people that did saw how those of us with more resources were being subsidized by people who worked for a sub living standard wage. And a couple of people recommended the book to me, and then I read it, and I recommended it to some other people. And it was a book that would change your way of thinking about low wages and the unfairness of it. And I think the same thing could happen if we saw films or had a group read of a book that talked about racial or ethnic injustices or unfairness. So that I would be in favor of doing a group viewing or a group read. And I certainly will go back and read the film now, watch the film now that I have the link. Thank you.
And thank you for your comment. To me, by doing it this way, we put it out ahead of time so that people that want to read the book would have the opportunity to do that before the discussion. But for people, for whatever reason, who don't want to read the book, could still watch the interview and understand what's going on. Mary?
Yeah, I was just gonna share. So both at the Y, we did some community conversations, which were just kind of open. But what I really liked about them was that it was over a period of time. So you met 3 times is what we did at the Y. They opened it up to staff and members. And then for 3 consecutive weeks, you met and you talked. There was a facilitator. There were just like some very open-ended questions that guided our discussions. And it was really nice because not only did you just have that one moment to talk, but then you could reflect and think. And then the next week, the discussion got richer and deeper. And then the third week too, even though these were people that you didn't know 3 weeks ago, I feel like we actually got to a place where it was like, well, if I saw you on the street, I'd stop and say hi. You know what I mean? And I think that is kind of what we want. We want mixed groups, age, diverse, you know, young, old, coming together in these ways. And then in the end, if you saw somebody on the street, you'd recognize them, say hi kind of thing. So that was like my first thing. So we did that with that. And then also I'm in Celebrate Diversity Fox Cities. And we did a similar thing, but that was where we had a presenter. So Dr. Pam Herr was our presenter. She gave us a 2-hour kind of like about microaggressions and about the diversity differences and kind of the data, the numbers we went through today. And then we, for 3 months after, met with those breakout groups and again had those discussions. And you know, did you see any microaggressions? We kind of journaled about it. This is what I saw. This is what I saw. You know, we checked our white privilege for a month and then got together and talked about that. And again, in those kind of circles over the months, we were able to just develop those, you know, support, feel comfortable giving our real opinion and sharing like, well, this is where I am in my journey and this is where I am. And so I don't know how this will look or what. And I did tell them all too, I was like, hey, Winnebago County, you know, get on the group. So, so I was just saying, like, I have found those types of presentations and then the conversations, and not just one conversation, but maybe 2 or 3 after, have been really useful. And it gives you that sense of community within the larger context. So
I do think that that is the consensus. You know, it's sort of what we intended to do a year ago. For various reasons, it didn't continue to play out, but we had intended to continue to have discussions like that. And I can say with certainty that there were almost 70 county employees on that lunch call. And so many of them were just so thankful, and they were interacting with each other and with the presenters. And had we been able to do something along the lines of what you're saying, where it was maybe a monthly opportunity, I think that those connections would have been a lot stronger. So I think that I think what you're suggesting is the consensus that it's not that this isn't a one-time showing and a one-time discussion by any means. It's ongoing opportunities. Absolutely. So, and I think it's all up to all of us to determine, you know, what's the next one. So if we're going to do the Waking Up White, then what's after that, and what's the next one, and what's the next forum or mode to do it? Is it a book club? Is it more of the videos? Is it presentations? And so this is where you all have the opportunity to put forth ideas on how we feel like the rest of the community can continue to learn and grow.
Beth, I also want to point out that UW Oshkosh does a lot with bringing in speakers to speak to this, and I think they have an influential speaker, and I'm sorry, the name is like went out of my brain because it's Thursday, but they have a speaker coming in April. It's an online, I think, where people could listen to that speaker. I will share that link with you. I'll send it out. But I think it's a good opportunity to, if resource-wise, share resources so that we can get there too.
I was going to talk to Timber on Monday he's from the university, about connecting with some of that stuff so that we can all be aware. Now that we have a link on the county website for this committee, it will create opportunities. I think one of you mentioned that you saw about this meeting on that link. So, you know, we will be able to get more of that information out about other entities, whether it's Fox Cities or the university. The university also sponsors some LGBTQ opportunities to learn and grow. And so we will be able to put more learning opportunities on that site. it's a government site, so we have to be cautious about what we do and how we do it, but there will be more opportunity. So, but thank you for the suggestion. For purposes of time, I did want to talk about the bylaws. Mandy had sent out a draft, and let's see here, let me pull this up. Wow. And all kinds of stuff going on here. I think I've got a hard copy here. Do any of you have any initial comments on the proposed bylaws? I know the couple of points that I wanted to make sure we touched on today were at the beginning of them. It's in the second paragraph. And hopefully you can all pull this up from the agenda. Under Article 2, Section 2, it says that the appointment will be made on a rolling basis for general membership. And my understanding from the resolution was that appointments would be made for the steering committee on a rolling basis. But I think that's a mistake that where it says general membership, because what we've talked about all along is that anybody should be able to call into these meetings like today without having to be appointed. So I don't know if anyone had caught that or had thoughts on that.
I think you're correct. That's the way it has to be, because we're open committee. We want people's input.
So that should be really based on the steering committee is going to be appointed by our executive, our county exec, and the rest of it does apply to that. That I wanted to address was under Article 5. It's right now it's blank for duties of office, duties of officers. So I don't know that we can resolve that today. I don't know if people have thoughts on what those duties would be beyond what's already mentioned. I mean, I'm sorry, it says chair, vice chair, sorry about that. It has some of those duties identified of what the membership steward and the secretary, what their duties are. But then at the end of that, it says the community liaison, and there's nothing under that. So are we looking at having a community liaison officer? And if so, what would the role of that person, or what would the duties be?
Would this liaison officer be for the bigger group or for the diversity?
Out of the steering committee. It looks like there's a chair, a vice chair, a secretary, a membership steward, an extension liaison, who I believe is Mandy, and then a community liaison. But it's not defined what that role would be.
I mean,
and we can wait till Mandy gets back, because she's the one that put that in there. And I emailed her last week to see what she had in mind for that, but I didn't hear back. So maybe we just have to table that.
You know, Beth, I don't want to jump ahead a little bit, but on an extension liaison, one of the last sentences is reporting to the Extension Oversight Committee 3 times per calendar year. I mean, it's understood that the county board made this commission, this steering committee, whatever we call, we answer and we have to report to the county board and not to the Extension Committee. I just want to make sure that that's understood.
I believe that her intention was that it would be both, that she needs to report to the, and Steve, you might have thoughts on this too, that she would have to report to the extension 3 times a year, and that there would be accountability to the county board as well. I think it's both.
Yeah, on the extension meeting, we never actually talked about that. I mean, because we're using her time, she may want us to report to the extension committee because we are using her time. So that may be why she feels that it's necessary for us to let the committee know what we're actually doing with her time.
Yeah,
That
I
would be
think
the only
that's-
purpose I would see that. But I wouldn't think it would be unreasonable, because if she is facilitating the meeting for us, we are taking her time out of the extension office. And I would think the extension committee periodically would like an update. It's like the fair committee, that they come twice a year and give us an update on how the fair is going and how they're proceeding. You know, even though we have no real function with the fair, they report to us financially so we know what they're doing. And I think that she's looking at the extension committee would like to know that her time is being spent, used wisely, and that it's worth, you know, them having her facilitate this for us. They want to see some value for their time, I guess. That's
That
what I
makes
would
perfect
think.
sense. Yeah, it does. The only other thing I noted on the proposed bylaw was just a grammatical typo thing. So other comments, suggestions regarding what was drafted so far? So
My
I
only
think
question is, Beth, did you have any thoughts on how you're going to work on the mission statement?
Heidi, do you want to step in at all and comment on that, or not really? Otherwise I can answer.
I think go ahead and answer. Yeah, I'm just kind of observing today.
Okay. We are looking at having someone assist us with developing a mission statement and strategic plan. So rather than spend a ton of time in these meetings just everybody trying to figure it out, we're going to have someone help facilitate that. So that will be one of our next agenda items. I think the next agenda will be, we're meeting May 8th, I believe it is. No, it'd be May 6th, I believe is our next meeting. And one of the topics would be to approve the bylaws once we iron out the things that we just talked about, and then to work on the mission statement and strategic plan.
Now, I want to get this straight. These bylaws are for the whole big general group and not the small group. I want to make sure that's understood, because I want to answer that question first.
Yes, it is. It's for the entire committee.
Because, you know, one thing I told Mandy, and we have to, you know, the resolution said that everyone has a 2-year term. I know it's mainly a minor thing, and I'm open to, but that's one thing that we have to resolve, that everyone gets a 2-year term.
And it will
Now,
be a two-year
to answer the question,
term.
to answer the question that before about someone could serve for 1 year and then resign and leave. But yeah, I'm just saying that's what the resolution that we passed, the county board passed, stated.
Yep. Sorry to interrupt. They will be 2-year terms, but for starters, the first half of the people appointed would serve a 1-year term, so that everyone's term isn't ending at the same time, that there would be, I think she referred to it as a rolling terms. And I think a lot of committees within the county, or at least a lot of the ones that I'm familiar with, originated that way, where for the ones that do have term limits, they staggered the initial terms just so that there wouldn't be that whole turnover. So it would only be for this first appointment that some of the committee members would be a 1 year, and then moving beyond that, it's all 2-year.
I'm not against that, but let's make sure you get that clear with the Corporation Council. Okay.
We did check with Corp Council, and they said that it's up to us if we want to start it out that way, that there's nothing within the resolution that tells us that we can't start the terms that way. That was from Mary Ann Miller. But again, if the consensus here is that we shouldn't do that everybody should start out with a 2-year term, we can, you know, because we don't have a steering committee right now, we can make that decision. I think Mandy brought up some good points at the last meeting about why that might be beneficial.
How would that be decided? Who would be with a 1 year and who would be with a 2-year term? Or could that be a choice of the candidates?
that's our hope, is that it would be a choice of the candidates. Knowing that if someone is on for a year and they want to reapply, they can. But for people who are a little bit, I'm not so sure about this and willing to be one of the one-year persons or appointees, then that's how we would prefer to do it.
But that would mean that if someone came in on 1 year, decided they like it, they still have to take a 1 year off before they can apply again. If I'm reading the
Correct.
Article 4
Correct.
correctly, yeah.
I don't mean to back up, but we are understood that the county executive appoints all 7 people. We all know that, right?
Yes.
Okay, and so I'm trying to answer. I lost my thought. By term limits, we're saying your term is up, June of 2021, and then the county executive, or we say, hey, so and so, you want to be appointed for another 2 years, they can still be reappointed. Correct, right? They don't have to go. And I guess one thing I don't think they have to go through the appointment process. They have to get the agreement of the county executive to get reappointed, but that's understood, right? That wasn't totally understood.
Yeah, that's something we need to determine, because many committees that we currently have an application. Some of them have a less formal process, and some of them it's really gotten to a point for longstanding committees that it's really essentially someone emailing Mark Harris with what the interest is of the person and what their background is, and there isn't a formal application. I think that we wanted to do something more formal initially, but down the road, it might just be that someone simply expresses interest in coming back on.
Well, I guess I would like that more informal process, because that's the way almost every county committee does that.
We should maybe clarify that in the bylaws. Would that make sense?
Oh, I think so.
Ambiguity about what this all means and how it all works. I think that's certainly something we can write into these bylaws to help provide clarity.
I'd be interested too, Beth, to see if, just because this is a brand new commission, if those people who ended up with the 1 year for the first term, if there would be some sort of exemption that they would be able, just for the first year, because you could have a lot of people who are very interested, and then you could have a lot of people who decide it's not for them, and you could end up with a mess in a year or two from now where it might need to be a little bit more flexible than that in order to have a really strong start and good foundation.
I think that's not the first time you and I have had the same thought at the same time. As we are clarifying this within the bylaws, that's certainly something that we can choose to write in there, is that for the initial people that are on the 1 year term, they can choose to end the term and be off the committee, or they could choose to extend it for 2 years just for this starting up of the committee. That makes a ton of sense. But again, we'll redraft this up and try and come up with a final draft by the end of the next meeting.
So let me further clarify a couple things. Are you saying the 5 community members would be that way? And I guess, and Steve, I think you agree with me, maybe now. I think the 2 county board members should have their 2 year terms, and they should be up every even year after the spring election, after we get reelected or not reelected. I mean, that I've served on a few different other committees with county board supervisors, and I don't know why the county board supervisor's term doesn't end when the supervisor's terms end. They can reapply, but you would say in May of 2022 and every 2 years after that, that would be up. And then the 5 community members, you can divvy up. I'm open to what you're suggesting, split up, or having all the 5 one time split up. But that's what I would like to clarify and get straight.
I would like to propose that with the county board members, you would have one who had a 1-year term and one who had a 2-year term, that you wouldn't be flipping the county board members both at the same time as well if they both decided to leave and not
Okay, that's
renew.
something we can also identify in here.
Any other input?
And just to reemphasize, because there has been some confusion on all of this, that whether you're on this appointed steering committee or not, we strongly encourage you all to continue to participate. And as you've experienced today, you don't have less of a voice. You don't have voting privileges unless you're a steering committee member. But we want the voice of our entire community to be heard when we have these meetings and discussions. So I don't want people to shy away just because you're not on the steering committee.
Well, Beth, I'm gonna pick a bone. I don't like the word steering committee, you know that. Why don't we just call, it passes Diversity Affairs Committee, why can't we just, Commission, why can't we call it that?
You mean the 7 people?
Yeah.
I mean, we can call it executive committee, steering committee, but I mean, there's this big group of us right now that are all part of this. And then
I
there's,
understand that, but the resolution said, called it a Diversity Affairs Commission.
so you're saying that the commission would only be the 7 people?
No, you can have 7 members, and then you can have other people who are non-voting members, but yeah.
So how would you identify the 7 voting members as opposed to the rest of the committee?
You call them, I don't know. I've heard it called executive committee, or I don't know, something like that. I don't know, but I just like, it's not.
We can change
me,
it.
I don't like the word steering committee because that's too general. I mean,
okay, so
you
executive.
You can say Diversity Affairs Committee executive, and then you could have working group or something like that. I mean, I don't, you know.
Okay.
In the resolution, I have a copy of that, and it does say that creating a Diversity Affairs Commission comprised of 7 members appointed by the county executive, specifically 2 county board supervisors, 1 of whom is a member of the UW Extension, and 5 county citizens representing various diverse groups within Winnebago County, with each member serving a 2-year term concurrent with the terms of the county board supervisors. This steering committee will represent the larger community coalition of interested individuals. So it talks about that steering committee as, you know, I guess representing the commission.
Yeah, if the term, I wanted to look that up as I was writing notes. If the resolution says steering committee, Mike, I think that unless you want to propose a new resolution to the county board, we're pretty much stuck with steering committee.
Beth, we've got a couple of things in comments. If I can interrupt for a second, it looks like Catherine maybe needs to jump off and has an announcement. If we could just pause for that quick.
Thank you, Jody. I appreciate that. I know for those of you who have been around for a while, we had talked about right pre-COVID, my immigrant experience that I had created, where it's kind of a self-guided experience of give just a pinch, a taste of what it's like to be an immigrant in the area. I have made it COVID friendly. It is ready to push out. So anyone who's interested in that should go ahead and email me their mailing address, whether they want it to come to work or whatever, and you can go through the experience on your own.
Oh, I'm glad to hear that. Thank you.
Yeah, so it is all ready. I've actually pushed it through a group of university students last fall, and then the university students I'm working with this year or this spring have also gone through it. So it's working out well. So anyways, I do have to go. I thought we were done at 4:30 today, so I have to step off.
I kind of have to go too because I had something up planned after this, but thank you for doing that, and I'll make sure it gets in the notes because that will be a great opportunity.
Okay, sounds good.
Those other comment?
And then back to the conversation we were having, Sarah just suggested that maybe the conversation about the name could be part of the conversation about the mission, if those, that I won't interpret. That's what she said. Thanks, Sarah.
Okay. Well, I've got notes and I will get some, and then we, like I said, we recorded this so that Mandy would have all the information, but I will follow up with her with everything we've talked about.
So Beth, I have a question. Since Mark Harris, the county executive here, how many applications do we have, and what is the status of filling the 7 positions? That's, you know, my big curiosity. Has Mandy shared with you who and what applications she has, and with Mark?
No.
I mean, when are we going to start? I mean, Mark appointed 5 people. I think, you know, when are we going to start, you know, filling that in, and then all these other decisions start to fall in place, and then we can start doing things.
Yep, she it comes back on Monday and has the application. So I would guess that we'll be meeting with you and Steve and her and I and Tom in the very near future to go over those. I don't have the date, but because I know she's scheduling it, but I know that that's one of her priorities when she returns next week.
If I could, Beth, I just want to thank you and the rest of the staff that are actually taking the time out of your day to do this. I know you could have easily said you didn't have the time to do it, but you believe it needs to be done. And I just want to thank you for all the effort you put into this, because when I first attended, I truly didn't think there was any diversity problem. But after I opened my eyes, I can see there's a big problem. And just thanks for all the work you're doing to help us to make correct this.
And Beth, I'm along with Steve, you, Heidi, Nikki, Susan. I mean, I think once we get past this minutia, this organizing stuff, I think a lot of we're going to agree and we want to do things, and that's what we have to get past. And I hope as soon as we get to that, the more things we can maybe do some action items. But I'm not in a hurry for any action items. But I think a number of things we talked about, I am really wanting to start. So thank you, Beth and Heidi and Nikki and all the county staff.
And thank everyone on the call, everyone who's been participating. There's a lot of excitement, passion, and energy toward these efforts. And so I think it's very encouraging that we can continue to move that marker in terms of who we are in our community and how we welcome each other. So have a great evening and a nice holiday weekend.
You too.